Central Alabama doctors and nurses have spent the past 7 months treating people with COVID-19, and tonight there is no end in sight. WVTM 13's Chip Scarborough explains why the disregard of some people is really taking a toll on these healthcare providers.
We have not really seen a light at the end of the tunnel.
Dr. Ellen Eaton is an infectious disease specialist at UAB. She spent the past several months treating patients with COVID-19.
And if you live in a community where individuals are not wearing masks and are out and about, there's a pretty high chance that someone is going to bring an asymptomatic infection into your waiting room.
Doctors in our area and around the country have become more and more frustrated with people who view the virus as a minor health threat or worse, a hoax.
I've heard from physicians and nurses who have had to make a policy that really no mask, no service. And they've had to do that to protect their staff and their other patients.
And that frustration only grows when doctors and nurses drive through local neighborhoods and see large gatherings, people flat out disregarding health guidelines.
It is quite frustrating for those of us who are taking care of sick patients to see that disconnect.
A disconnect that has healthcare providers connecting outside of work to share their experiences.
Many physicians have been quite vocal about the mental health burden of COVID on the individual providers who have, many of us picked up extra shifts, working nights and weekends to then have to battle this misinformation around the severity of the disease is really not sustainable, to be honest.
Doctors and nurses doing what they can to make the next few months more bearable. In Birmingham, Chip Scarborough, WVTM 13.